Hello, today we're at SHSU Hospital investigating a strange occurrence of a fungal infection. Joining me today is Dr. Muker.
I'm sorry, who let you in here?
Oh, so what can you tell me about the outbreak?
I guess I can talk to you until security arrives. I'm Dr. Mupor, and I specialize in diabetic care.
Okay, so what about the outbreak in the hospital today?
Well, my day started with reading patients' charts, and I'd seen that almost all of my patients had nosebleeds at night. And I went to investigate that. I did a physical exam, and I found out that this was no common nosebleed. So it had seemed pretty consistent that the cause of every one of my patients' nosebleeds was due to the same thing. So I did a tissue biopsy from one of my patients, and I found it to be a zygomycete.
A zygo what? What is that exactly?
A zygomycete encapsulates two types of fungi that like to cause opportunistic infections, which are infections that like to affect individuals with a weakened immune system, or those with systemic conditions that are favorable for that organism. The fungi that I suspect is the culprit here is the Rhizopus.
Is that contagious?
It's not contagious. The fungi can be inhaled or ingested or introduced into the body's circulation by injury or injection. We did some investigating, and after finding that the air system was clear of any spores or mold growth, we found that the linens of each of my patients that they've been sleeping in was contaminated with mold.
Don't you wash the sheets here?
Our hospital definitely washes the linens here. However, what may have caused this growth is improper drying of the linens after washing, creating a perfectly nice and warm and moist environment for the mold to grow. What's most important now is that we treat our patients. We'll be treating our patients with systemic antifungal medications, surgical debridement if they need, and of course disposing of those linens and monitoring for any more cases in the hospital.
Okay, well thank you for your time today. It's been an interesting day and we'll bring it back to y'all.
Hi, joining us today is Dr. Lopez, a researcher and scientist in fungal infections.
Thanks for having me.
So, Dr. Lopez, can you explain to me why you and the SHSU staff didn't have these infections from Rhizopus?
Sure. The Rhizopus is an organism that makes an enzyme called ketone reductase. This enzyme allows the fungus to thrive in high glucose acidic conditions. The blood serum of a healthy individual would not have these qualities and inhibit the growth of Rhizopus. The diabetic patients of Dr. Mucor here at the hospital made ideal candidates because many of them were hospitalized for their diabetic ketoacidosis, which stimulates the Rhizopus growth. One could assume that the patient had inhaled the spores and they weren't able to clear the spores from their nasal turbinates. A healthy individual would just clear the spores through inhalation, ingestion, and digestion through the GI tract.
Okay. So, is there anything else that would make someone an ideal candidate for a Rhizopus infection?
Yeah, so the Rhizopus uses furoxamine, a cytophore that allows for increased iron uptake by the fungus. And this is critical for fungal growth and tissue invasion. Patients with diabetic ketoacidosis, like the patients here, have elevated concentrations of free iron. And supporting this basically supports the growth of Rhizopus. There are other conditions that may predispose a patient to suffer a Rhizopus infection, conditions like AIDS and even organ transplant patients.
Okay, so this has been reporter one getting you on the inside scoop at the devastating outbreak at SHSU Hospital, and I'm going to turn back to my colleagues at the studio.
Okay, and we're back at the studio with a surprise guest for y'all. The culprit themselves has decided to call into our studio and tell us all about them and their plans for humanity.
Yes. I'm here to tell you all about my evil plan for humanity because none of you can stop me.
I admire your courage in appearing on air, but what makes you think that humanity can't stop you?
Two things, my dear reporter. My ability to go where there's airflow and my aggressiveness once I get where I need to be.
Aggressiveness is one thing you definitely have, but why do all of this?
With my Sedair force siphoning your iron away, I can grow as much as I want, as fast as I want.
I wouldn't bet on your reign of terror right now. I'm getting another report from another one of your reporters at the hospital, and it looks like good news for humanity.
Wait, what?
Hello, we are back at the SHSU hospital to investigate patients who have been contracting mucormycosis from exposure to Rhizopus in the hospitals. Here we have patient
Joe?
joining us today. How are you doing today? And can you tell us your story?
Hi, I'm Joe, and I'm currently on treatment and the path to recovery from my mucormycosis.
Can you tell me if you were admitted to the hospital for this condition or if you developed it after your stay at SHSU hospital?
Well, I was actually admitted into the hospital for a bone transplant treatment as a patient with leukemia. I was staying at the hospital for about 2 to 3 weeks before this happened.
Oh no, I hope you're doing okay. What was exactly the symptoms you were experiencing when you had this infection?
Well, I had dizziness, and then came the double vision, and really bad headaches during the night. And it wouldn't even go away when they gave me some strong pain medications.
Do you think there was anything in the SHSU hospital that could have caused all this?
Yeah, I actually heard something about the linen sheets here, or the air vents that had some sort of fungus that they called all of this for me and a lot of patients.
I'm so sorry to hear that. I hope they put you something to treat the infection.
Yeah, they did. I don't know all of them, but one of the medications was called amphotericin, I think. I had to take it as an IV. It's been about 3 weeks since I started this treatment, and I think it's going all right. The symptoms are pretty much gone.
That's amazing to hear. For now, that's all that we have for today, and thank you for sharing your story again.
I'm sorry, how did you get in here?
Yes,
Rise.
Rise.
The Riz.
Miss Rizopus. I'm my. Sorry.
It's my line. Sorry.
Oh, wait.